Immunization can prevent illness, disability, and death. But almost 20 million infants did not receive routine immunization as recently as 2017. To reach the last mile and achieve universal vaccination coverage, we need to address complex local contexts and multiple barriers to vaccination. A 3i scoping study suggests that programs that are co-managed with the community are more likely to be successful. It also showed a clear lack of evidence on the effectiveness of community engagement approaches to increase immunization coverage.
In low and middle income countries, there are both demand as well as supply side barriers to immunization. There is a major evidence gap on what works in engaging communities to actually address these barriers. When we look at these hard to reach populations, these issues become even more challenging in these contexts.
Evidence suggests that barriers to immunization vary across contexts. Parents may not be aware of the benefits of immunization or may fear side effects. Travel costs and the long waits at health centers can also put people off. Some parents may not be aware of where and when immunization services are provided. And for migrant and pastoral communities, accessing inconveniently located health centers can be daunting. The irregular supply of immunization services and shortage of health staff have been major barriers to improving the supply of immunization services. Health providers may also not have any data for tracking parents who stop bringing their infants and children for vaccination. These barriers have contributed to low and stagnating vaccination rates locally, nationally, and globally. To tackle them, 3i is supporting an evidence program that will assess innovative approaches to engaging communities. The program is supporting 6 formative evaluations and 7 impact evaluations in Nigeria, Ethiopia, Uganda, Kenya, Pakistan, India, and Myanmar.
We are evaluating 3 different kinds of innovations. The first innovation is on technology. Like these children are wearing these vaccine indicated bands on their legs. There are digitized pendants, and they're supposed to actually remind mothers on when to take their children for immunization. The second kind of innovation is on community engagement itself. So there are highly participatory ones where communities are actually using collaborative checklists to assess immunization services. And there are those in which community members are actually scripting as well as acting in these informational videos. The third kind of innovation is on how to really take these immunization services to hard to reach populations like pastoral communities. And over there, we are involving traditional as well as religious leaders to improve immunization services.
Immunization is one of the most cost-effective approaches for protecting infants and children's health. By generating evidence on how to tackle the multiple barriers to achieving universal coverage, we can break through the stagnation and ensure that no one is left behind.